you. So the question will be dorsal vagus nucleus is present in the answer is medulla. Dorsal vagus nucleus medulla में present होता है. Another one is which hormone causes uncoupling oxidative phosphorylation with increased production, that is thyroid hormone increase uncoupling oxidative phosphorylation and heat production. Another one is patient had various episodes of diplopia, dizziness, and acute comatose with this basilar artery thrombosis. And the next one is corona radiata forms. Answer is granulosa cell. Granulosa cells form corona radiata. Which of the following ectoparasite? Lice is ectoparasite while all others are endoparasite. Low dose of estrogen pill causes hepatic adenoma. Hepatic adenoma is caused by low dose of estrogen pills. Correction of two things by which test we do correction by that is student T test. EEG of a patient shows EEG shows increased frequency of wave in active mind than in deep sleep. EEG. Sodium regulation is performed through osmoreceptors. Osmoreceptors causes regulation. Osmoreceptors have role in regulating sodium level in the body. So in this way, osmoreceptors, like in this picture, as we can see, when there is decreased sodium in the blood, sensation on osmoreceptor causes aldosterone release from cortex. It will reabsorb sodium along with water, and it will destabilize the blood sodium level and blood pressure in the body. So next one is which form of thyroxine is an active form? It is unbound form of thyroxine is active form. And the next one is which of the following is different from plasma osmotically? That is 5% dextrose water, while NA's plasma protein fraction and ringa lactate are same. Like sodium, NS contains sodium, ringa lactate contains potassium, and plasma protein fraction contains plasma proteins. While dextrose water is different than all of these groups. Vasopressin and oxytocin means radiation. Oxytocin originates in the hypothalamus and then goes down into the big pituitary posterior pituitary gland. Myxedema is caused by total lack of thyroid hormone. Myxedema coma is also done by that thing. Next one is in spermiogenesis, acrosomal cap is formed by, that is Golgi complex. Acrosomal head is formed. Most common breast tumor is invasive ductal carcinoma. Another related question to this is breast have 5 to 20 lactiferous duct. Polycythemia vera is a condition in which there is increased RBC mass, cells does not raise. RBCs are increased, which cells does not raise in this condition. These are lymphocytes does not increase. When lymphocyte increase, there will be lymphoma will be there. Lymphatic drainage of the cervix occurs in the internal iliac node. So another related question is lymphatic drainage of tongue. Anterior tip of tongue is done by the submental lymph node, while anterior two-third is through deep cervical lymph node. Pharyngeal lymph node is derived into the superficial group of deep cervical lymph node, and the lateral part is drained into the submandibular lymph node. So this is very important thing to memorize. Next question is a patient has abdominal surgery for the mass, remained in hospitalized, get cardiac abnormality, left shows increased potassium level. What probable cause of this increase in potassium level is? So the options of this will be prolonged antibiotic usage, no, there is no role in antibiotics and potassium level. Postoperative infection is no role, while prolonged bed rest can increase potassium level. And another one is antibiotics should be given at the operation table, not before or after we give antibiotics. but before we do not give. The next one is substance which is maximally reabsorbed by the kidney is glucose is maximally reabsorbed at the PCT level. And next one is a main developed pain on the calf muscle on the walking 100 yard which settles after taking rest. Which artery is involved in the calf muscle? That is popliteal artery. Popliteal artery, and popliteus muscle is also known as peripheral heart. Regarding middle meningeal artery, most appropriate is involved in the extradural hematoma. Middle meningeal artery involved in extradural hematoma. Minerals not found in or minerals with low bioavailability are the tubers like roots are the minerals with low bioavailability. A boy with history of trauma, perineal region swelling, scrotum and anterior abdominal wall swelling, but does not goes down, and the urine does not go down, and rupture of bulbar urethra is there. Bulbar urethra rupture results into these types. Here in this image, we can see that how bulbar urethra is present. Bulbar urethra rupture results into the accumulation of urine. When here bulbar urethra is ruptured, accumulation of the urine will happen, and swelling will be in the scrotum because urine will go here and then into the anterior abdominal wall. Also anterior abdominal wall swelling will be there, but did not go into the thigh because membrane prevents going of urine down in the thigh. So in this way bulbar urethra prevents. Okay, so the next one is beta receptor stimulation causes increase in heart rate. Beta receptors increase heart rate. Drug interaction occurs with pharmacodynamics and pharmacokinetics, both drug interaction. Next one is sodium neutralization. Which ion is used? That is chlorine. It's because sodium chloride, sodium chlorine interaction is there, so sodium neutralization can be formed by chlorine. Another one is GABA deficiency in globus pallidus and substantia nigra leads to Huntington disease. GABA deficiency leads to Huntington disease, while dopamine deficiency results in Parkinson disease. So you have to memorize these differences. Okay, so Huntington disease is done by genetical mutations and genetical problems. Patient will have involuntary movement, swallowing problem, coordination, and memory loss, which is because of GABA deficiency. GABA mismanagement and imbalance results into the Huntington disease, and Parkinson disease is because of there will be low level of dopamine. So that's why the difference of Huntington disease and Parkinson disease will be there. Patient will have chorea, and another thing that is very important to memorize is globus pallidus and substantia nigra is important for Huntington disease. And the next one is cortisol is necessary for the action of glucagon, because cortisol is very important when while sugar maintenance. Glucagon and cortisol are related. Amoeba most commonly involved in cecum. Sebaceous gland are absent in palms and soles. Sebaceous gland deep inguinal ring is formed by transversalis fascia. And the next one is lymph from testes will drain into para-aortic node. Lymph from testes. So we will have to look at for the in-depth conceptual memorization of this. Here in this image, it is clearly mentioned that these are two balls, testes covered in the scrotum, and then lymphatic goes into the superficial lymph node, and then these superficial lymph node drains into the para-aortic lymph node. So lymph node goes into the para-aortic lymph node. Another one is deep inguinal lymph node. It is not correct because lymphatic from testis goes into the superficial inguinal lymph node and then goes into the para-aortic lymph nodes. Lymphatic from testes goes into the para-aortic and deep lymph nodes. As we can see here in this image, there are superficial inguinal lymph node that goes into the internal lymph node, then common lymph node, and in testes there is para-aortic lymph node, which are from deep inguinal lymph nodes. No, sorry, from superficial inguinal lymph nodes. periodically.